In this module, we will talk about the subject of interactive lecturing, and we'll try to answer the question, how can we encourage audience or class participation? 3 suggestions are, first, make sure that the talk is tailored to the level of the audience. You don't want it to be so far above their heads that they can't understand the material well enough to even make a comment or ask a question, but you don't want it to be so basic that they become bored and tune out. Remember that some situations work better than others for interactive learning. The ideal situation is when people already know something about the subject so that they can make some comments and ask questions either of the speaker or of each other. Third, keep the interest of the audience, often by switching gears and by asking them questions. Instead of using slides with all text, you may want to show a picture or a figure for people to identify or for you to ask a question about, and that will automatically get their interest and move them from passive into active mode. How can we engage our listeners and increase audience participation? Try to create a one-on-one atmosphere and speak in a conversational tone. Instead of thinking of yourself as lecturing to a class of 100 people, try to think of 100 one-on-one conversations with the group. And this will automatically make you speak in a more conversational tone and make the listeners be more likely to ask questions or to interrupt you or to say something back. Remember to create a safe atmosphere. No matter what someone says or asks, do not laugh or put them down. Never pimp an audience or a class member. If you want them to ask questions and to make comments, invite them to do so at the beginning. You can actually say, as I go along, please feel free to stop me at any time if you have a question or something to say. Telling stories to reinforce points is another way to engage your listeners and oftentimes to get them to make some response. In medicine, we're lucky because we have a wealth of stories that we can tell about our patients, about ourselves, about things that we did right or wrong in taking care of patients. And oftentimes, these are the sort of things that cause the audience to really be engaged and perhaps to tell a story of their own or to make a comment. When you ask a question, don't be afraid to wait for the answer. Don't be afraid to let several seconds of silence fall while you wait for the audience to say something. If they don't respond, you can reword the question or ask it in a different form, perhaps with sentence completion or a short answer where someone can shout out a single word instead of feeling that they have to make a long, elegant comment. It's often helpful to create stopping points and to encourage discussion. For instance, if you're talking about a case, after presenting the case, you may say, okay, before we go on, does anyone have any questions about the case or any more information that you need about this? You can also stop in between topics in a lecture and say, for instance, before we move on to talking about treatment, does anyone have a question? And if possible, it's helpful to be able to assign topics to small groups in the audience and to allow them time to work on them. This works well, for instance, when you're making medical team rounds, and you break your team up into several small groups and have each group work on the answer to a question or on a short case that they may have to analyze, give them some time to work, and then come back together and have them present their findings to each other. And finally, here are several practical suggestions. One is, as you practice your talk, try to actually put yourself into the listener's place. Try to notice what is not clear, to anticipate what questions the listener might ask, and to look up the answers to those questions so that you'll be ready in case they do ask them. When giving the talk, look at the monitor rather than the screen so that you're actually facing your audience, and that way you can see and monitor their response, whether they look bored or confused, whether they're turning to each other and asking questions, or whether somebody may be starting to raise their hand to ask a question, and you can ask them for a comment. Oftentimes it's helpful to pick out people in the audience and imagine that you're talking to them one-on-one. This, again, causes you to be more interactive. Oftentimes the people who sit in the first few rows are the most interested and engaged and are the easiest to interact with. And finally, again, if you're trying to get your audience to talk and they won't answer a question, you can try either sentence completion or short answer questions to encourage their responses. So I hope that you find some of these suggestions useful in making your lectures more interactive. These suggestions can be used even with a fairly large group.